Today's topic is aneurysms, causes, symptoms, diagnosis, and treatment. An aneurysm is a serious condition characterized by the abnormal bulging or ballooning of a blood vessel due to a weakness in the vessel wall. Normally, our arteries and veins are strong, flexible tubes that carry blood throughout our body. They're built to withstand the constant pressure of blood flowing through them. But sometimes, a weak spot can develop in the wall of a blood vessel. When this happens, the pressure of the blood flowing through can cause that weak spot to bulge outward, like a balloon. This bulge is what we call an aneurysm. It's kind of like when you blow up a balloon and one part of it stretches out more than the rest. Aneurysms can vary in size. Some are small, about the size of a pencil eraser, while others can grow to be as large as a grapefruit. The danger with aneurysms is that as they get bigger, the walls of the blood vessel get thinner and weaker. If an aneurysm gets too big, it can burst or rupture, causing internal bleeding. This is a medical emergency that can be fatal if not treated quickly. Types of aneurysms. There are several different types of aneurysms, named based on where they occur in the body. The most common types are: number 1, cerebral aneurysms. These occur in the brain and are also called intracranial or brain aneurysms. They're often found at the base of the brain in a network of blood vessels called the circle of Willis. Number 2, aortic aneurysms. These occur in the aorta, the main artery that carries blood from the heart to the rest of the body. There are two main types of aortic aneurysms: thoracic aortic aneurysms, which occur in the part of the aorta that runs through the chest, and abdominal aortic aneurysms, which occur in the part of the aorta that runs through the abdomen. Number 3, peripheral aneurysms. These occur in arteries other than the aorta. They can happen in the neck, groin, or behind the knees. So how common are these aneurysms? Well, the prevalence of aneurysms varies depending on the type. Brain aneurysms are fairly common, estimated to affect about 3 to 5% of the general population. However, most of these never cause any problems. Abdominal aortic aneurysms are found in about 1.4% of men over 50 and are less common in women. Thoracic aortic aneurysms are rarer, affecting about 6 to 10 people per 100,000 each year. Causes of aneurysms. The causes of aneurysms can vary depending on the type, but there are some common factors that can increase the risk. One of the biggest risk factors is smoking. The chemicals in cigarette smoke can damage the walls of blood vessels, making them more likely to develop weak spots. High blood pressure is another major risk factor. The constant force of high blood pressure can weaken blood vessel walls over time. Age is also a factor. As we get older, our blood vessels naturally become less flexible and more prone to weakness. This is why aneurysms are more common in older adults. Some people may also have a genetic predisposition to aneurysms. Certain inherited disorders that affect connective tissue, like Marfan syndrome, can increase the risk of aneurysms. For brain aneurysms specifically, there are some additional risk factors. These include excessive alcohol consumption, drug abuse, particularly cocaine, and certain infections. Head injuries can also sometimes lead to the development of brain aneurysms. In some cases, aneurysms can be caused by atherosclerosis. This is a condition where fatty deposits build up on the inside of artery walls. These deposits can weaken the artery wall, potentially leading to an aneurysm. Symptoms of aneurysms. This is where things get a bit tricky because many aneurysms don't cause any symptoms at all, especially when they're small. They're often discovered by accident during tests for other conditions. However, as aneurysms grow larger, they can start to cause symptoms. For brain aneurysms, symptoms might include a severe headache that comes on suddenly, often described as the worst headache of your life. This can be accompanied by nausea and vomiting. Some people experience a stiff neck or blurred or double vision. Sensitivity to light is another possible symptom. In some cases, people might have seizures or notice a drooping eyelid. In severe cases, loss of consciousness can occur. These symptoms often happen when the aneurysm ruptures or leaks a small amount of blood. This is called a sentinel bleed, and it's a warning sign of a potentially larger rupture to come. For aortic aneurysms, symptoms can include deep, constant pain in your abdomen or on the side of your abdomen. Some people experience back pain. If the aneurysm is in the abdominal area, you might feel a pulsing sensation near your navel. If an aortic aneurysm ruptures, it can cause sudden, severe pain in the chest, abdomen, or back, depending on its location. This is often accompanied by symptoms of shock like rapid heart rate, dizziness, and pale, clammy skin. Peripheral aneurysms in the neck or behind the knees might cause a pulsating lump that you can feel, or pain, swelling, or numbness in the affected area. It's important to note that many people with aneurysms don't experience any symptoms until the aneurysm ruptures. This is why aneurysms are sometimes called silent killers. The absence of symptoms doesn't mean there's no risk, which is why regular checkups and awareness of risk factors are so important. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Diagnosis of aneurysms. Diagnosing an aneurysm typically involves imaging tests. The specific tests used can depend on where the aneurysm is suspected to be. For brain aneurysms, a CT scan is often the first test done. It can show bleeding in the brain and is usually readily available in emergency situations. If more detail is needed, doctors might order a CTA, or computed tomography angiography. This is a more detailed CT scan that uses a special dye to highlight blood vessels, making it easier to spot aneurysms. The most detailed test for brain aneurysms is a cerebral angiogram. This involves inserting a thin tube into an artery in the groin and threading it up to the brain. A special dye is then injected to make the blood vessels visible on X-rays. While this test is invasive, it provides the most comprehensive view of the blood vessels in the brain and can help doctors plan the best treatment approach. For aortic aneurysms, the diagnostic process might start with an abdominal ultrasound. This uses sound waves to create images of the inside of the body and is often used to screen for and monitor abdominal aortic aneurysms. It's a quick, painless test that doesn't involve radiation, making it a good option for initial screening and follow-up. If an aortic aneurysm is suspected or detected on ultrasound, a CT scan might be ordered. In some cases, an MRI might be used to diagnose aortic aneurysms. This can provide detailed images of the aorta without using radiation. It's especially useful for people who can't have CT scans due to allergies to the contrast dye or other reasons. For peripheral aneurysms, the diagnostic process might involve a combination of physical examination and imaging tests. Often, a doctor can feel a peripheral aneurysm as a pulsating mass. Ultrasound is frequently used to confirm the diagnosis and measure the size of the aneurysm. Treatment for aneurysms. For small aneurysms that aren't causing symptoms, doctors might recommend a watch and wait approach. This involves regular monitoring with imaging tests to check if the aneurysm is growing. The patient might also be advised to make lifestyle changes to reduce the risk of the aneurysm growing or rupturing. These changes often include quitting smoking, controlling blood pressure, and maintaining a healthy diet and exercise routine. For larger aneurysms or those that are growing quickly, surgical intervention is often necessary. There are two main types of surgery used to treat aneurysms: open surgery and endovascular surgery. Open surgery involves removing the damaged section of the artery and replacing it with a synthetic graft. This type of surgery is more invasive and requires a longer recovery time, but is often necessary for aneurysms that are difficult to reach with less invasive methods. Endovascular surgery is a less invasive procedure that involves threading a catheter through the blood vessels to the site of the aneurysm and placing a stent graft to reinforce the vessel wall. This method typically has a shorter recovery time and is associated with fewer complications. For cerebral aneurysms, treatment options include surgical clipping and endovascular coiling. Surgical clipping involves placing a metal clip on the neck of the aneurysm to stop blood flow into it. Endovascular coiling involves inserting a catheter into the aneurysm and filling it with soft platinum coils, which induce clotting and prevent the aneurysm from rupturing. In cases where an aneurysm has ruptured, emergency treatment is required to stop the bleeding and repair the damaged blood vessel. This may involve open surgery or endovascular procedures, depending on the location and severity of the rupture. After the initial emergency treatment, Patients may require ongoing monitoring and additional interventions to manage any complications and reduce the risk of future aneurysms. Remember, when it comes to aneurysms, early detection and treatment can be life-saving. Now, we want to hear from you. Did you or someone you know have an aneurysm before? How did you discover it? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.